Today, we're getting under the hood of Dr. Somi Javaid, a mother, daughter, sister, board-certified OBGYN, a leading women's sexual health thought leader, and menopause advocate. She is the founder and lead chief medical officer of HerMD, a team on a mission to make women's healthcare exceptional by educating, advocating for, and empowering patients to take control of their health concerns. Dr. Javaid earned her medical degree from the University of Cincinnati College of Medicine, where she also completed a residency in Obstetrics and Gynecology and was chief resident. She was an assistant professor of gynecology at the University of Cincinnati Medical Center. Dr. Javaid completed her preceptorship at the San Diego Institute of Sexual Medicine and is a NAMS North American Menopause Society certified and ISSWSH International Society for the Study of Women's Sexual Medicine member. Honored by her peers in 2014, she was named a Cincinnati top doc and is now considered an expert in sexual medicine and menopause. Dr. Javaid has been featured in Forbes, Vogue, Well and Good, InStyle, Parents, Refinery 29, Mashable, Adweek, and Pop Sugar. In 2020, Dr. Javaid spoke about gender bias and the female sexual health revolution on the TEDx main stage. And in January 2021, she was featured in Women on Top for her work as a trailblazer and pioneer in women's sexual health. Wow, welcome, Somi.
How are you?
Awesome. So you have a storied career. What an introduction. I would love if you would share with our audience, like when the journey to becoming and being in healthcare happened.
I was always interested in science and math. My dad's a veterinarian and I would help him with surgeries and answering phones and taking care of animals. But what I found frustrating in veterinary medicine was the patients couldn't talk. My father said they could, but in their own special way. I was at Northwestern and was pre-med and unfortunately got a phone call that changed my life forever. It was my father on the other end of the phone and said, "Somi, you need to come home." And I get emotional and choked up talking about it because my mom was only 45 and she had been complaining about chest pain, left arm pain, and shortness of breath for weeks. But because data and science couldn't explain why a thin, non-smoking woman would ever present with four vessel disease, they kept telling her, "Oh, it's too much caffeine," or "Your children are stressing you out." And I flew home emergently, looked at her EKG, and I was like, "This is abnormal." And the cardiologist is like, "No, women's EKGs look different." Just totally blew us off. She ended up finally getting a cardiac catheterization. She coded and had to go emergent quadruple bypass surgery. So we were robbed of the chance to wish her well, give her hugs, that pre-op, because you don't know if you're coming out of surgery or not, right? Especially after you code. And luckily, my mother is alive and well to this day. But that was my aha moment, that women needed an advocate, that women needed data. And so the story's a lot longer. I'm going to let you ask questions because we can pause there.
I can't imagine being in college and getting that call. What was the next step for you? So, that was your aha moment. So you're a pre-med major. What did you do from there?
So I moved home for a couple of weeks. This is when email was just coming out. Completed a lot of my senior year kind of remotely from Northwestern because my mother needed help and my brother and sister were young. And then went on to medical school residency, got my first job, and the realities of healthcare really, I say, smacked me in my idealistic face. I was seeing 50 patients a day. I didn't have time to be an advocate or listen or process, even to have time to eat or go to the bathroom. And so when my personal because I am a mother of three, and professional timing was right, I went home and I said, I felt like a failure. I was like, I'm failing these patients. They're telling me these stories of sexual pain and dysfunction and survivorship and menopause, and my hand is on the door and I'm practicing doorknob medicine and I'm in a room for like 7 minutes and they've waited 6 months for these appointments and I'm failing them. I'm failing my children. I'm never home. So I told my husband, I said, I'm either going to quit my job and stay home and raise these babies, or I'm going to start something. And he was like, good God, woman, you will drive us nuts if you stay home. And so literally cashed in my 401k, my life savings, bought a building and started a practice. And I wrote 3 words on a piece of paper: empower, educate, advocate, because I wanted to give a place to women where they were heard and they were partners in their care.
I just want to go back a little. Did you know after when you went into medical school and did residency that you were going straight into OBGYN?
I knew I wanted to do some type of surgery, and that love of surgery came from assisting my father. I love the ability to take a problem and fix it for someone. And so it wasn't though until I delivered my first baby that I had that life-changing moment. You get to be in this room and witness a miracle. There's one person and all of a sudden there's 2. And for me, that's when I was like, oh my God, this is what I want to do.
Oh, I love that. Thank you. I'm really happy that I asked that question. So, as you progressed, you started your own business. I don't know how many years ago that was before HerMD. Talk about that experience and how it grew, what you saw and what you noticed and did.
Yeah, so the first thing I noticed, there's so many barriers to healthcare, but time, you heard me talk about that. So I was like, we're going to have longer appointment times. We're going to offer expertise in menopause, sexual health care, and survivorship because patients need time to discuss these very sensitive issues. And I wanted to take insurance because that's the other barrier to care is cost. I started this gynecologic menopause sexual health care practice in Cincinnati, Ohio, not LA, not Miami. People were like, this will never work. And noticed patients from 35 states, 3 countries, including a woman who drove 2 days to come see us, people coming from all over the place. And so it was, I started working with my sister, who is also my co-founder, Kamal Caruso, who is a brand and marketing expert, and Kathy Lai, who worked in, she was a retired investment banker, but she was helping startups with modeling. And they were consulting with me, and we call it the magic of HerMD. They were at an event where 200 women showed up. And this is back way before the menopause gold rush. And they both were like, listen, we like our gynecologists. Number 1, they've never asked us about our sexual health. Number 2, people don't come hang out with their gynecology staff after hours. Like, we're on to something here. Let's scale this and bring this to women and to patients so they don't have to travel as far to access the care that they deserve. So that's when we figured out we had tapped into a huge void in the medical system.
You had that spark, you had that moment, you were based in Cincinnati. How long was your practice before it became HerMD?
So we bootstrapped for 6 years. So 2015 to the end of 2021, opened a second location in Kentucky and remained profitable through COVID on our own. 3 minority women from the Midwest went into fundraising. We were told we had less than 0.5% chance because, less than 2% of all VC funding goes to women. You add minority women with no ties to the VC world, and you get down to less than 0.5%. And we raised $10 million in a matter of weeks because I think the investors' opportunity and locked on to the mission, the vision, and the story of what we were doing at HerMD, plus our outcomes and our data and the reviews were just outstanding. We were really giving women the care and patients the care that they deserve. And so we've fundraised a couple times. We've raised $30 million to date, and we are continuing to increase access both virtually and with our brick and mortar locations.
So what did you see as it relates to HerMD with your bricks and mortar and your virtual care?
Yeah, so we are still seeing about 8 out of every 10 patients coming in brick and mortar because at some point, most patients require an exam, whether it's a pap smear or a pelvic exam, an ultrasound, a biopsy. Some women, some patients just feel more comfortable knowing that they can have a face-to-face with their provider, and they really want to be in the physical location. And so our physical locations provide not only consultations, annual examination, routine gynecologic care, but also advanced gynecological care. So we can take care of abnormal pap smears and do colposcopy and LEEP. We also have in-office surgical centers. And so we can do ablations to treat heavy bleeding. We can, if people are very nervous or have had traumatic pelvic exams before, we have sedation, we have Pronox, we can put people to sleep for that kind of thing. We can do DNCs all under conscious sedation. And so that's really nice. We have imaging, so you can have pelvic ultrasounds, phlebotomy. So, you don't just hand someone a lab order and say, okay, now you go off to the lab. We draw you right in the office, and that's covered under insurance. How are you supporting these really long appointment times, 20, 40 minutes, 60 minutes when we first opened, and doing all of this with an insurance-based system? I needed something to offset, because insurance doesn't pay people they deserve to be paid, to be able to pay your staff and the overhead and the brick and mortar. And so each of our locations has a medical spa in it, which is cash, which then offsets the cost of the longer appointment times. But it's a win-win because we need a very little crossover. Most women are seeking those services anyways, and you don't have to. So it negates the need for concierge or even a membership.
That's an interesting model. That is really smart. So the med spa gives you the opportunity to give the patients the longer time. That's brilliant. Like, was that just a lucky thing or was that a planned thing?
No, that was a planned thing. I did a lot of research when I left my job. There was 6 months while I was building out the location, trying to figure out what financial model would work. And I had visited a few friends who had opened a medical spa that had some cash-based GYN services that treat genitourinary syndrome menopause, that treat incontinence, and they added medical spa services. Because think about it, a woman who has, for example, hormonal imbalance, polycystic ovary syndrome, has hirsutism or hair growth. She wants laser hair. She may have acne issues, and so she wants, facials to treat that. Women who are in menopause, they want hormone therapy, but they may want Botox and fillers because of the changes, with lack of estrogen and collagen and elasticity. And so it's not, this is where I got people to lock on. It's not a 1 + 1 = 3 business. They truly feed each other because it's holistic care. But you can opt in or opt out. And that is what I wanted. I wanted patients to have autonomy and choice over their bodies.
That's awesome. I'm saying, as a woman, that's just awesome. That is such a wonderful offering. And so how many locations do you have and what are you imagining?
So we have 4 locations. We service 5 states currently virtually. What do I imagine? Partnerships with companies, partnerships with hospital systems, which will allow us to expand much more rapidly, but also allow us then to have more rapid access to internal medicine, to psychiatric services, to the things that HerMD doesn't provide. And so if we have those partnerships with hospitals, it really allows the hospitals to concentrate on the obstetrics and allow us to take care of the GYN patients, the menopause patients, the sexual health care patients. And so that's what I see in our future.
What are you seeing from an opportunity, an unmet need and opportunity perspective as a thought leader in this space?
So what I'm really excited about, we're not nearly seeing still the dollars we need, but we are seeing, I was just at the New York Stock Exchange event, and there was $1 trillion represented in the room. So I definitely see that investors are more interested. I have been to DC a couple times, and we've seen the initiatives with the menopause bill and the research. And women weren't included in clinical research trials until 1993. That's what nearly killed my mother, right? There was no data. So I definitely see more research. I see more interest in funding. I definitely see more entrepreneurs and companies popping up in the virtual healthcare space to give women access to menopause care, which I think is wonderful because not everything needs a brick and mortar location. I still believe, that's why I believe in HerMD, that it's an integrated model that women need because at some point you do need an examination. So having that capability is really nice, particularly if you need surgery or a biopsy. And I'm seeing a lot of innovation as far as direct-to-consumer products. And we're seeing lubricants and vibrators and Sephora and Ulta and Target. And I also see a lot of celebrities who are using their voices for the collective good. Naomi Watts, Stacey London, Christina Aguilera just launched a playground, for sexual wellness. And so I think it's becoming less taboo. I see women being braver about talking about their sexual health. And let's be very clear, when we talk about sexual health, it's not about just contraception, fertility, or treating STIs. It's about talking about arousal and orgasm and satisfaction and pain and lubrication, all of the issues that women may see in their lifetime. 43% of women struggle with some type of sexual healthcare issue in their lifetime. That's nearly half of us. So this is not just a lifestyle medicine issue. This is a game changer. I've seen marriages and relationships end over genitourinary syndrome of menopause, over mood changes that happen with, menopause or sexual healthcare issues. And so I'm seeing a lot of innovation, and that makes me happy. In fact, there was a research study that was presented at one of the major medical conferences on vibrators. Can you imagine 10 years ago talking about that? No. So it's finally getting, I think, the attention, or at least the momentum that it deserves.
How do you, like, as you see your patients, and I don't know, as a chief medical officer, are you still seeing patients, by the way?
I am not. I stopped in March. There's a lot of education and research and speaking and advocacy, so that I'm focusing on that now. Yes.
Well, actually, then this is a perfect question. Do we call them patients or do we call them women who are at this life stage? From what you're seeing, you've been on so many stages having this conversation. What have you seen in terms of that?
Yeah, I think, call them patients, individuals. Some people call them consumers if they're, selling a product to them. But what I'm seeing that's really, really smart is oftentimes so many medical questions come up. So the panels I've been sitting on, it may be a founder, but then there's usually always a medical professional or a doctor who is present, along with a celebrity if it's their product, or they want to just bring awareness and they're the face of the brand. What I have seen is that this issue of menopause being the golden girls has really changed. And now it's Michelle Obama and Oprah and J-Lo and Naomi. And it's really made women braver and less fearful about aging when a celebrity, is willing to talk about it. And I think it takes a lot of bravery for them to discuss it, because for them, it can have career implications, right? Yeah, they may not get the roles that they want. And I think all of that is changing now. And so for me, I think I applaud it. And I applaud the transparency and the bravery it takes to use your stage to discuss these very sensitive issues.
Yeah, I like that. I really like that. I think what's also interesting about that, Somi, is the fact that while these celebrities represent, they're on stage, to your point, they can use their platform. Everyday women are going through that same experience. To talk about menopause, if you're, in the C-suite, in advertising, you're not supposed to be above 50, above 40. Your career starts on the decline when you go through perimenopause. I mean, it's insane. And in a lot of companies, it's an interesting thing. You have to be, we're so sensitized as career women to not speaking about these issues, which truly affect our ability to show up. You have a silent quitting culture of women because they're dealing with these health challenges.
Oh, 900,000 women left the workforce in the UK because of undiagnosed menopause. And, the average age in the United States is 51. And so you hit the nail on the head. When we're leaving our careers in our prime, we've worked and worked and worked to get there, to get that seat at the table, and then we're leaving it because we are worried we're going to have brain fog and forget a very important thing during our presentation. We're worried because maybe we're in an old building and the air conditioning is not great and we don't want to be sweating profusely. We're leaving broadcast TV because, the hot lights are there and it may induce, hot flashes. We're leaving because maybe there's not a bathroom on our floor and we now struggle with incontinence and we worry about having an accident at work. And so because of these, and this is what's maddening to me, they're all treatable. It can be under control. It can be fabulous. And nobody has to leave the workforce if they don't want to. They just need to be diagnosed and offered treatment options.
Yeah, no, I think, I really appreciate that. That's great for the audience to hear. If they just addressed and thought of HRT, and I know that there's different physicians, who are very, very big advocates for hormone replacement therapy. And then there's other physicians, there's a cadre. What do you think about that? Like in the state of menopause, and how do you sort of think about your patient in that context?
We did women a huge disservice with the WHI. I am a huge advocate of hormone therapy, but I'm also an advocate of choice. And so I may think it's the most fantastic thing for a patient or an individual, but if she doesn't want it or she's fearful, once she's been given the true data and explained and the myths have been dispelled, it's truly her choice. And so for me, I believe in a curated plan. So whether it is hormone therapy, whether it is prescriptions that are non-hormones. So now there's two that control vasomotor symptoms, for example. Brisdell is one and Veozah is the other, the one that made headlines for doing the commercial during the Super Bowl. There's two FDA-approved medications that treat low libido, Addyi and Vyleesi. And then there's also, pelvic floor physical therapy, there's counseling, there are the devices that I talked about that treat genitourinary syndrome of menopause. There's localized hormone therapy. There are so many options to treat, the head to toe symptoms of menopause and all of the sexual health issues that may arise. And so for me, it's about autonomy, it's about choice, it's about data, it's about education. Oh, and then the other stuff we talked about, vaginal lubricants and moisturizers and vibrators. I don't call these things toys, they're tools. And they're, meant to address an issue that no one should blush about. We did not get here, by some miracle. Most of us got here from sexual activity. For me, that's what it's all about. But I am a big proponent of hormone therapy. And if you look at the WHI data, I mean, so many people have talked about this, right? It was studied, one drug was studied, both arms, Premarin and Prempro. So two drugs, but they were not bioidentical. They were conjugated. They were only oral. It was a large proponent of women that were more than 20 years beyond menopause when we see the most benefit, right, at the timing hypothesis within the first 10 years of menopause. So the study had flaws, and we never called a press conference when all of the good data came out, right? Like there's decreased mortality on estrogen alone. If you develop breast cancer on estrogen, you also had decreased mortality. You have decreased risk of cardiovascular disease. So there's so many benefits to bone, brain, and heart with hormone therapy, not to mention treating vasomotor symptoms. But I still believe in autonomy and choice for patients.
So if you can share with the audience, like what you're doing, because I know you're on a lot of stages, and what you're talking about and what you're doing in terms of educating and advocating for women.
So, my belief is number one, teaching women about their anatomy, because a lot of women don't understand. Number two, really debunking the myths and all the damage that we've done in the press as providers about hormone therapy. Number three, setting up HerMD University so that I can train the next generation of providers. I think right now we have one doctor for every 33,000 menopause patients, something astronomical. Like we have such a shortage of people who are trained in menopause. So making certain that the next generation, this does not happen and that we continue to train. And then talking about all of the treatment options so that no one feels alienated or isolated, because there are some people that are not going to be candidates for hormone therapy for a medical reason, because of something they've been through, a family history, whatever you want to call it. Although there's more and more and more data coming out that is more inclusive of everybody and showing that most people are candidates for at least localized therapy. And then, talking to them about the FDA approved treatment options. It's striking to me that most women know what Viagra is or Cialis, but they've never heard of Addyi. They've never heard of Vyleesi. These options to treat hypoactive sexual desire disorder or low libido. And so my goal is to talk to them about all of their options. And even if they want to dip their toe and say, Dr. Javaid, just tell me a really good direct-to-consumer, over-the-counter brand. I love doing that as well. And that's why I don't sell my own, like Dr. Javaid, like white labeled products. I curate, products that have data, that work, that are safe, because those are the two things. You want to make sure that it does what it says it's going to do, and that it doesn't have a lot of side effect or harm, right? Or adverse events is what we say. And so I love to recommend products as well. And so that's what I'm doing, giving people education, autonomy, and choice. But then I'm also talking about and making a lot of noise about all of the barriers that exist: funding, research, not enough women, decision makers. And so making sure that the right people are hearing this message so that we can make the change that we need to.
I want to go back for 1 second to your university, HerMD University, and the fact that you're educating next generation. Are the physicians on staff currently, are they NAM certified? Are they menopause? Like, what does your sort of program look like?
Yeah, a lot of them are NAM certified, and it's great that people go to continuing medical education courses. But I was talking to my husband, who's an oncologist, and he was saying that, his nurse practitioners have gone, but then maybe they don't see a patient for 3 months, right? Because he's an oncologist, but they do some survivorship, but maybe they haven't seen anyone in 3-4 months with sexual healthcare issues. And so they're like, oh God, what did I learn at that conference? And so what we did with HerMD University is we basically created care algorithms that are based on, ISSWSH and NAMS, clinical pearls from practicing for 20 years. It's all peer reviewed, evidence-based. You combine that with side-by-side visits with HerMD experts, people who sit on our medical advisory board, lunch and learns, continued journal club, and giving them the latest, greatest data and articles that come out. And so I'd say we're beyond NAMS certified. So they all go to NAMS, they all go to ISSWSH, then you have to take a test to get certified. So some of them are attended, some of them are certified. I don't believe you have to be certified. There are people who aren't, including myself. I've attended, because I haven't taken the test. I've done 20 years of education beyond that. So our providers, we say 100% are trained in menopause and sexual health care. And currently in this country, 31% are trained. Yeah. And in 10 years, we've only gone from 20% trained to 31% trained.
I think what you're doing is really commendable and important. That's really important work. Next gen.
And what do you do when you're like the only one in your practice who's gone to the conference, and then you come back and, like I said, 6 weeks later, you have a patient, you're like, what was that lecture about? As adult learners, you have to have the message repeated, and you have to learn like multimodal. And so that's what HerMD University is. And that's the other thing I wanted to tell you. So we have collected outcomes data about this adult learning approach and what we're doing, and shown at ASCO and Menopause Society, which was formerly NAMS, and ISSWSH, over and over again, our outcomes are superior to status quo. And we have another one coming out. I can't announce it yet, like what we've proven, but again, superior outcomes, and we're presenting it at Menopause Society in September. I can't release that data yet. So it's truly data driven.
You're a wonderful combination of all the things that women need to feel safe and go into a physician's office around women's health.
And I find it so fascinating because that is the one thing during medical school and residency that they tried to train out of me, but they have loved as an entrepreneur and an advocate is the charisma and the approachability and the, laid back nature. But when you're talking to women about things that maybe someone has embarrassed them about or they don't feel comfortable, the last thing you want to do is have this like arrogance, this distance, this yes, professionalism, but there you can't appear cold. And I remember being called into a room, being told not to wear a ponytail anymore because I looked too young, being told that I was too casual in my interview style and the way I spoke to patients. But I knew who I was and who I wanted to be, and I knew the outcomes that I was getting and the patient volume that I was building. And so thank God I stuck to who I was, and I didn't listen to those people who I feel like were trying to beat the empathy out of me. And so thanks for that.
Well, no, it's a really special quality. And there's a few physicians who I've met more recently in the past 2 years. Is that like some of the criteria you look for, separate of course, clinical acumen?
Oh, for sure. It has to be someone who is going to kind of lead that HerMD magic and that culture in the office, but also be that culture carrier for, the patient. And that's the other thing we didn't really talk about. Why are physicians leaving the workplace? Well, number one, COVID. It's really, really sad. I think we're going to lose over 40% of our workforce that started at the beginning of a COVID by 2025. And what is it going to take to keep physicians working, mission-driven work, better work-life balance, and the ability to make the same amount as their male counterparts? And the fourth one is to kind of climb that, I don't want to say corporate ladder, but to be able to have that career move and that upward trajectory. And we make all of that available at HerMD. Our providers don't take call. They have less appointments per day, obviously, because the appointment times are longer. And so when you take care of your providers, they take care of your patients. And so what people were worried about is as we scaled, we would lose the magic. Our reviews are still 4.9 across 5 states.
I think you hit on something, not just the HerMD magic. When you take care of the providers, they take care of the patients. It's so nice to have such an open and just, heartfelt conversation. I have one last question, which is, this is your platform to give women a message, women of all ages, of all backgrounds, of all cultures. What do you want to say to them?
You have one body. It is yours. Take care of it and make the decisions that are right for you. Do not allow guilt or taboo or shame to get in the way. And I'm already teaching this to my 2 teenage girls. There is that you have one body, take care of it.
I just love that. And I love the fact, we didn't get into the fact that we have daughters, but when we think of this next generation, what are we teaching them? So thank you so much for getting under the hood with me today. Thank you so much.
Thank you for having me.
Thanks for listening to Under the Sisterhood. If you haven't already, please give us a quick rating and review on Apple or Spotify. And make sure to follow us on Instagram, Facebook, YouTube, and LinkedIn so you can hear from more amazing women. This podcast is created and hosted by Under the Sisterhood LLC and Elizabeth Elfenbein, produced by Elizabeth Elfenbein and Matt Butler, and edited by Matt Butler. The music is by Ayla Schaefer. Her song, Rose.